Welcome everyone to our workshop on vaccinations that's going to be provided. There are actually six of us on the screen, right? 2, 4, I don't know. Five of us on the screen. And that includes Laurie Herndon, who you all know, the president and CEO of AtlantiCare, also a Stockton alum. Dr. Manish Trivedi, who is the infectious disease specialist at AtlantiCare, and I've sort of made him an unofficial Stockton alum. He's been so supportive of what we're doing at Stockton. And of course, Emery DeGiorgio, another Stockton alum, professor, first year studies, and also, is a senior leader of the faculty at Stockton, and is worked very closely with Peter Barada throughout the semester on UROC and before on UROC, and they'll be here to answer questions later on in the session. Next one, Peter. And Peter Gallagher. Update on today's agenda is our spring 2021 semester. Then AtlantiCare will answer questions submitted by students, faculty, and staff through UROC, and then additional questions can be submitted through today's Q&A function. Next one. All right, Visit Health, which is one of the entities that's providing free testing at Stockton. They're at Lakeside Lodge, 4 days per week. Since February 3rd, almost 600 testing appointments have been scheduled, which include residential and commuter students, faculty, and staff. Test results are available within 2 to 3 days. This on-campus partnership has improved our outreach and response time and contact tracing efforts. This is something we wanted to do this semester. And special thanks go to Steve Radwanski and Chris Howard for securing this service on behalf of the Stockton community. Next one, Peter. There's been more requirements, and this is good things, by the state. And so all colleges and universities now report additional COVID data to the New Jersey Department of Health. Certainly the number of COVID-19 positive employees and students, the previous week's total, as well as aggregate from the beginning, and then the number of students in quarantine and isolation. This helps the DOH monitor health trends and overall impact of COVID-19 on college campuses. And we want to thank Adrian Wiggins, Scott Houston, Ashley Williams, and Amber Burry for the work they've done to secure the data necessary to meet the state's requirements. Next one. Okay, before we go here, I'm going to turn it over to AtlantiCare. Let me thank everyone at the Stockton community for their work in ensuring that COVID-19 is as much under control as it possibly can be. I want to, encourage folks, and you'll hear it, to get vaccinated. Both Lynn and I have been vaccinated, and there is a sense of relief associated with that, both vaccinations. And I think some of the issues that concern folks will be discussed today. So with no further ado, let me turn it over to my colleague, dear friend, Laurie Herndon, the CEO of AtlantiCare.
Thanks, Dr. Kesselman, and thank you all for having us today. We know there's a lot of questions about the vaccine, so we'll get to that in a few minutes, but this is your time to ask us the questions. We have 19 questions that we've already gotten that we'll lead with. And hopefully by the time we're done, we'll have answered, whatever is pressing, and encourage you all to consider getting vaccinated. Both Dr. Trivedi and I are both vaccinated, and we're both glad that we are, aren't we? So we have a couple of slides just to show you that nice trend. Our high watermark was in early January, where we hit 140 admitted patients across both campuses. That was a tense time in our organization. We were never overrun, but it was our high number for in the first wave was 86. So that was a significant jump up. And then you've seen that nice trend line. We were talking as we got here today, we're still seeing, sadly, a fair amount of new patients come in. Yesterday, we had 13 new admitted patients. So it's not, some days it's single digits, but there are days where there are more. We're still seeing people die from COVID. sadly. And so it's just as serious as it has ever been, even though we're finally, getting the vaccine in people's arms is giving us all hope. And we do know that it is really the only way out. So I know, Dr. Trivedi, you've been on the front lines of this with us. There's thoughts when those trend lines came down. It was a good feeling, right?
That was an exciting time for sure. When you see 140s, you get really kind of a little nervous just because of the clusters that occurred during that holiday season. As you see the numbers trend down, that's promising, but they still are hovering around those 50 mark. Today, we're seeing more admissions as well. And I think that's just a sign that we need to continue educating about vaccinating, continuing to do what we're doing as far as wearing masks, physical distancing. I anticipate the trend to go down further once the community gets vaccinated further, but that's where we are today.
I think I have one more graph. You can keep going there. So there's, you can kind of see the up and down. Just look, we did get to 0 cases like for a few hours back in July. I don't think this graph shows that, but that was a point where we're like, okay, we're going to get through this. But then we saw those cases just grow over the months that followed. Next slide. And here's just, we just monitor some different metrics just as an example of new hospital admissions per week. So you can see, how it grew and then how it's starting to trend down. But again, we are seeing a little uptick, in the last week or two, and, still well below where we were, but still an important thing to continue to monitor. Next slide. And then this is just to share with you how much rigor goes into, if you will, and this is back in February, but I'm not going to go through all of these different metrics, but you can see there's a lot of different colors as well as things that we're paying attention to, which helps guide our actions and, what we need to be doing on the front lines of everything that we're managing, over at the organization of AtlantiCare. And then next slide. And this is just, another graphic of what's playing out across the state. These colors and numbers have changed dramatically during the year that we've been at this. But again, these are some of the things that we're all looking at as it relates to managing everything that's playing out as we continue to respond and fight the virus. I think that might be our last slide. So what we're going to do is we're going to go through some questions and we'll talk about some of the things together and hopefully, answer, whatever thing that really is sticking as a point of needing clarification. So here's the first question. Is that vaccine safe, Dr. Trivedi?
It absolutely is. So, these vaccine processes go through different phase trials. People are always concerned that this vaccine was expedited, but it didn't skip over any of the clinical trials that you would need to render it safe. It's absolutely safe. The technology isn't something new. We've learned about this technology and used it for quite some time, just reapplied it towards these vaccines.
And like 10 years, right?
It's been exactly around the 10-year mark since we've learned about this type of technology using messenger RNA, but to apply it to a vaccine, this was the first time we were doing that. So we had the tools there. We just needed some more information to make a vaccine, which is what we did.
And I know in the trials, we're talking thousands and thousands of people, like 40,000 for both Pfizer and Moderna, Johnson & Johnson, right?
Exactly. When you look at clinical trials in general for different meds, usually it's 200, 300 people. This was going into the 40,000, 50,000 mark of people enrolling into these trials. So we have a robust amount of data here.
And that's what's making us so comfortable, right?
Exactly.
And stepping up. So what would you say to convince someone to get the vaccine who's reluctant?
Yeah, so, there's I get this question a lot, that they're nervous, and you really want to sit down and get some more information as far as what their reluctancy is. The biggest key factor, and what I try to educate my patients about, is that you're doing this not only for yourself, but for your loved ones. The problem with this virus is that it's easily transmissible. And so because of that, you can spread it to loved ones close to you who may not have an opportunity to get the vaccine. So it's a way to get involved in caring for your community and your families.
Right, especially parents, protecting their children, protecting their parents, right?
Exactly.
It's very important. Here's a question about the megasite. We've been on the front lines with the megasite from the beginning. First vaccine in the arm, January 22nd. We started in the hundreds. We're now, the state has asked us to prepare to get to 4,000 vaccines a day. I think when I looked, our first doses are probably close to 55,000 as of yesterday. So we've been doing a lot of vaccinating. I think the challenge that we've had is the 5 or 6 mega sites are open to the entire state of New Jersey, as well as those individuals who go to school in New Jersey or also work in New Jersey. So I think, AtlantiCare, we post appointments 3 times a week, Tuesday, Thursday, and Saturday. And I did see the Saturday numbers, 43,000 people were on the site to get about 3,000 doses. So sadly, we still don't have the volume of vaccine that we would like. And there is no easy way around this. I do know that, especially for those over 65, there are a variety of community groups that are trying to help manage those appointments. And obviously, if you're not as computer savvy, it's not as easy because there is a timeout. So if you're not moving fast enough as you're, filling in all of the details, that not that we ask you a lot of questions, but enough that to schedule the appointment. So I recognize and understand it's been frustrating. We have received some Johnson & Johnson vaccine last week. That will be focused on our what I'll say, our homeless populations, people that are more transient that we're concerned about. And we talked last week, we're going to start dosing our cancer patients at AtlantiCare on Friday. And we're also going to start vaccinating some of our APG, which is AtlantiCare Physician Group, high-risk patients as well. So the point there is we're starting, we weren't getting vaccine either. All of it was just going to the mega sites, but now it's starting to open up.
Yeah, you're seeing it expand into the community pharmacies as well. So I think accessibility will be a lot more. The mega site's still doing an excellent job as far as rolling out the vaccine. So I would certainly try there first, but there are different avenues to obtain.
More CVS. I know I live in Brigantine
Right.
CVS. I haven't been able to confirm how many doses they're getting, but the point is everything is going to keep going up.
Exactly.
So it should start to get easier. Here's a question. Other than single dose versus multiple dose, are there significant differences between the 3 vaccines?
Yeah, so, there's 3 different types right now. The first 2, which is the ones that rolled out initially, were called messenger RNA vaccines. These were the novel vaccines that were first developed for COVID-19. The third one, Johnson & Johnson, is a more traditional vaccine, uses what's called an adenovirus vector. It's something that we've been using for vaccines over and over again, so it's well-known technology. The differences between Moderna and Pfizer are very subtle. Pfizer tested patients 16 and up, while Moderna selected 18 and up. So it's really just a 2-year age gap. That's actually going to be irrelevant now because they're starting to test in children greater than 12 years old in both arms. So, but other than that, it's really storage of the vaccines. And you're hearing probably in the news that the storage may not be that big of a difference now, that you could store Pfizer in a regular freezer, which kind of levels out that playing field too. So no difference as far as reactions are concerned. There's some subtle things, including people who have like facial surgeries with fillers and such, that they say you may get an inflammatory reaction with Moderna versus Pfizer, but very subtle differences in that regard.
And what about one shot?
Yeah.
What do you think? And people are like, well, is it as good? Should I wait?
I think the key to any vaccine really is to prevent you from having serious illness. You don't want to be seen in the hospital. You don't want to have to go to the hospital. You don't want your symptoms to progress where you need to be hospitalized. But at the same token, also life and death. These vaccines prevent people from dying, and that's a very important fact. And Johnson & Johnson did an excellent job with that, almost equivalent to the Moderna and Pfizer, which is really, really an important thing. It's one shot. You can prevent hospitalizations like that. I think that's a success.
Which I mean, I know people don't see what we see, but there
right.
are serious complications.
And we were just having this conversation that it's not just the patients that you would suspect, people with comorbidities, heart disease, diabetes. These are people that have no comorbidities at all, or that had undiagnosed illnesses prior, that really suffer from this virus. So I think at any opportunity to get a vaccine, you certainly should take advantage of that.
And it does still startle us after a year when we see somebody who looks more like us, healthy with no major issues, and they are fighting for their life.
And that's exactly
a horrible thing to see.
And that they really are fighting for their lives. Like just, I had a conversation today with a patient, and he's able to speak in full sentences, but for him to tell me that he's working on his will just in case is a real jarring conversation to have. And so it's really still out there, and it's causing a lot of hurt in the community.
Still. So we have, the question is, how many different brands? We have 3, right? We talked about that. Is there a way for me to check information in the future whenever it's my turn to get vaccinated? So there's a lot of information out there.
Right.
It almost feels overwhelming, I think.
It does. And you want some simplified information. Of course, the Atlantic County vaccine page has information as well. AtlantiCares pages have vaccine information as well to kind of break it down a little bit better for you.
And one of the things, if you do come in for a vaccination, we do have material at our clinics as well. Can a person select the J&J vaccine and not have the vaccine randomly chosen for them?
So it really depends on the site that you're going to. For instance, the mega site, currently we offer Pfizer vaccines. It's what the state allocated to the mega sites. Certain hospital settings, they have Moderna vaccines. And then, of course, J&J, you're seeing at other pharmacies. We have some at our hospital as well. So it's not so much a choice as it is to get vaccinated. In a perfect world, you would just go to get vaccinated and you'd feel confident about whichever vaccine you receive. But really, it's the center that determines that.
Here's a question. Is the vaccine free for students? Well, we know it's free for everyone.
That's correct.
Just want to reinforce that. And, we, are working very closely with the National Guard and volunteers and a whole variety of people to try and move that along. So yes, It is free. I do know that there will be a charge, I would imagine, as things kind of get into more what I'll call the private sector, where people will be charging for the actual giving of the vaccine, but the vaccine itself is free. What does it mean for J&J to be at 85 effective? That seems much less than the Pfizer and Moderna. Should I get it anyway?
So let's talk about that a little bit. So when Pfizer and Moderna first started their clinical trials, they had the luxury of not having to deal with the variant viruses. As J&J, their second phases happened to be with these variants all out there. So their numbers started to not look as good as Moderna and Pfizer. Now, 85% efficacy is really about preventing hospitalization and severe illness. That's an excellent number for the population for any type of vaccine, to be honest with you. Moderna and Pfizer's had roughly around 93 to 95%, but it wasn't not necessarily for severe illness. It was more so to prevent the acquisition of the virus or the transmission of the virus, but very different. I think if you ran those clinical trials again now with the variants, you'd see a lot different numbers. We know already that the UK strain against these vaccines does really well, but the other strains are actually able to penetrate through the vaccination. So those numbers may be a slightly different now.
And we are seeing some of those strains in the Northeast. And I guess there is a delay and a challenge to get testing. We talked about that last week as we were doing one of these sessions for our staff that, they want to see clusters. They have a specific protocol before they run out and spend the money to test. But you're still, that there's some of those.
And so we do know that in Atlantic County that we've seen some of these variant strains here. Now, to get patients tested for that has been exceedingly difficult just because it takes a lot of effort and work from the Department of Health, who's already inundated with different cases and contact tracing. So we certainly select and choose patients that we're really concerned about. But at the same token, we know that in Atlantic County, the UK strain has touched down. In New York, all 4 strains are there right now. So that's just a bus ride away.
Just a matter of time until it gets here.
So it's a matter of time, correct.
And I guess one of the things that people are interested in is the vaccine. So my second dose, once I get my second dose, when do you think I might need a booster? Is there a booster in my future? Do you think?
So, after your second dose, 2 weeks into it, you should have full immunity. Your antibodies should be revved up. Your body should be really acclimatized to the vaccine. But the boosters, they're already working on to help protect you against those variants. We don't know how long this initial vaccine will last for. We know that the initial trials were around 8-9 months ago, and we know
they're still working.
They're still working really well. So we know that they may last even longer than several years. The boosters more so in addition, so that you develop what's called spike proteins against these variants. And I think that you could probably anticipate early in the wintertime, probably next year.
So here's just a lot of news today from the CDC. So if I'm vaccinated, what should can I have a different step in my life? Am I still wearing my mask? Am I still standing back 6 feet?
No, so the CDC just today announced some recommendations about fully vaccinated individuals. So if you're fully vaccinated and you're around other individuals that are fully vaccinated, you don't have to wear the mask. You don't have to maintain that physical distance. If you're fully vaccinated and you're around individuals that are not vaccinated, you may not necessarily have to quarantine if you have a high risk exposure. But so you don't necessarily have to wear the mask in those circumstances either. They do recommend, though, that you wear the mask if you're around individuals that have a high risk probability of developing severe illness. So elderly population, people on chemotherapy, or a lot of comorbidities, you want to continue to wear the mask because the data isn't out there for the transmissibility after you get the vaccine. So you may still be able to spread some virus to patients that are susceptible, and that becomes an issue. But other than that, they are becoming more and more lax around vaccinated individuals.
But I guess back out in public, I mean, the fact is, going to a basketball game, or I saw with the Flyers, I know you're a hockey fan, so they had people in the stadium, you should keep, even if you're vaccinated, you really
do, because you don't know who's around you in the community, and you don't know their risk factors as well. A lot of these stadiums and arenas are making separations. They're doing the best with filtration systems and such, but there's no substitute for wearing an appropriate mask so that you don't spread the particles to other people.
Yeah. What about travel? If I'm vaccinated, am I taking a vacation?
Yeah, so we definitely stress that if you're going to be vacationing, to really use your due diligence, like on a plane where you're in a closed quarter, a closed environment, and the filtration system may not be as up to par. You may be susceptible to spreading virus to other people.
Wear my mask on the plane,
That's
right?
right. And so when you're in other areas, it really depends on the state. It depends on the country. Some of them require you to get tested before and tested after departure as well. But the vaccine is just another additional tool to make you feel more comfortable in those circumstances.
If a relative is sick and I'm vaccinated, could there soon be heightened restrictions or lightened restrictions, for visiting them?
Yeah. And so now is this about the hospital, for instance? We use different matrices in the hospital, as you kind of mentioned through your slides, different indicators that allow us to open up visitation and such. At home, if you're vaccinated and your elderly is ill for some reason, I still would exercise caution because of the potential for spreading that virus to them, which could be devastating in certain circumstances. Yeah. So you really want to wear the mask in those situations.
And just for everybody, we did, I guess it's 2.5 weeks now. Yep. We did open. I mean, it's heartbreaking for us to not have families with our patients, and we were in the red for weeks and weeks and weeks. One of the other metrics that we review, and we started to open up. We have one visitor, which is not making people happy, but at least one visitor for certain times during the day. So it's I think 11 to 1 and 5 to 7. That's right. And if the patient has COVID, we are restricting their visitors, but we have begun allowing people at end of life for COVID patients to visit for a very short period of time. So here's, we talk a lot in the hospital about this for women. So here's, if I'm pregnant, trying to get pregnant, what should I do about the vaccine?
Yeah, so, we'll start from the beginning with this. There was a study out there, an anti-vaccine campaign that suggested getting the vaccine would cause your own immune system to attack potential pregnancies. That's actually been debunked. It was an obscure paper out from Europe that really suggested there was a protein, and part of the protein would end up causing that issue. That's not true. So we've seen pregnant women get the vaccine. We've seen breastfeeding women get the vaccine. The national committees for OBGYN, they've all recommended that you should get the vaccine. We know that if you get COVID during those times, it can be devastating. You're at far higher risk of developing severe complications, including blood clots. So you really want to try to do your best to prevent that. So the recommendations currently are, yes, they outweigh the benefits, certainly outweigh the cons of that. So you want to get vaccinated as soon as possible.
And that's just not a national experience. We saw that at AtlantiCare,
That's
where
right.
women who, ended up with COVID, who were pregnant and were just delivered, they were sick.
We had
They were very
tough
sick.
illnesses.
So breastfeeding, if I'm breastfeeding,
Yep. So
get the vaccine.
So we know that the antibody that you develop antibodies that would pass through the breast milk. And the antibodies are similar, actually more robust than if you were to have natural COVID. And we know that patients that had COVID were able to breastfeed with no issues to the infant at all. It may actually have some benefit or protection to the child by developing or receiving those antibodies. So breastfeeding is okay.
Here's a question. I don't know if we've made any changes, but if I'm in labor and delivery as a patient, is it the same protocol now if I'm vaccinated? Are we testing everybody as they come through the door?
Yeah, so we're still doing the testing as you come through the door. As far as if you're a patient and you come in, you'll be tested. As far as having someone with you at the time, that's where the tricky part is. And as we've kind of opened up our doors to visitation, we're starting to open up our doors for that as well.
Okay. So for people who carry EpiPens, do they need to select a special vaccine site so they're in a safe environment when they have if they would have a reaction? Should they go to the medical facilities versus the mega sites? Are there currently one brand of vaccine that would be better for individuals who have that?
Yeah, so, really the EpiPen, or the idea of having severe allergic reactions to getting this vaccine, stems from if any of the components you have an allergy to, you should stay away from that. That being said, if you're not aware of that, you've tried to break down the vaccine components and you're still not sure, and you carry an EpiPen, all of the sites that are trained when they go and receive the vaccine on how to appropriately handle this. So typically, instead of waiting for 15 minutes or it being observed for 15 minutes after the vaccine, you're observed far longer, roughly 30 minutes, sometimes even longer. And of course, they're all trained in the BLS protocols, meaning if you have an allergic reaction, they have equipment there ready to take care of that. So any of the sites that offer the vaccine should be okay.
And I know at the mega site that we're involved with, we have a paramedic that is that we have that position. He's vaccinated or she's vaccinated, but there's all their gear in our clinics at the hospital. I've worked as a volunteer. We're ready to be with that person through that event if that happens. But gratefully, we haven't seen.
And I was just going to comment on that it's exceedingly rare. We haven't had an anaphylactic reaction, and based on all of the national studies and even the data for the trials, nobody's really had a severe anaphylactic reaction.
I know, which is absolutely wonderful.
Yeah.
So what are your thoughts about long haulers? I know you're managing some of these patients and the prolonged symptoms and, kind of what are you seeing in the general population?
Yeah, it's a very real situation, this Longhaul syndrome. And for those of you who don't understand what Longhaul syndrome is, it's having like lingering symptoms of COVID despite not having the virus. So brain fog, fatigue, sometimes the loss of taste and smell still exist, headaches. Some people have thinning hair, weakness. And these symptoms just seem to progress seem to just not regress. They seem to just stay stagnant for quite some time, oftentimes 3 months, 6 months, even longer. And that's become a frustrating situation for patients. And so, it's a very real thing. We've been dealing with this in managing this. It's a lot of different moving parts. There's unfortunately no real medicine to kind of help treat that. A lot of supportive care, a lot of boosting of your immune system, and then making sure that you didn't have an underlying diagnosis that just was masked or never got around to it. So we've uncovered a lot of autoimmune diseases and such, just based on workups. Certainly, if you have long haul syndromes, to get that evaluated.
And one of the things we're looking to do, you and some other physicians have been managing these patients, as this has been a new phenomenon, but we're going to shift over to more of a standard clinic setup where there'll be a number, there'll be a dedicated staff, right? We're looking like early April.
Exactly.
Or I guess maybe mid-April. But again, we're seeing enough of those patients that we know we need to organize ourselves a little better and differently. So let's see, I'm almost done here with my list. How does a person who has multiple underlying conditions over 65 get an appointment?
Yeah, so, this has been like a big question and a frustrating part for a lot of people, getting on the mega site, waiting in line. My suggestions, of course, is to try to get on the mega site as soon as possible when you know that vaccines are going to be available. Don't be discouraged that there's going to be more and more vaccine available, and those numbers should start to be easier and easier to get. Of course, if that's not a way to go about it, there's different pharmacies locally that are offering the vaccine as well. And shortly, you may see it in your physician's offices. So just to stand by, but be persistent. It should be available.
And like I had mentioned, there are many communities that are embracing this and helping, people through the process. I know I saw Ocean City. I know some different charities are involved. And I think the other opportunity really is, I think initially people thought they went on the state site and they thought that they were registered and that somebody was going to call them. Yeah. And that is, you need to be registered, but then you still have to go look for your vaccine.
That's right.
And on the AtlantiCare mega site, you have to, go in and set up a password. There's some things you have to do before you get ready to set up your appointment. Can a person receive the vaccine if they have a sinus infection?
Yeah, so really we would like you to get the vaccine when you don't have any underlying conditions or illnesses flaring up. That being said, a sinus infection doesn't preclude you from getting the vaccine. We just want to make sure you adequately treat that as well.
As a result of COVID-19 pandemic, all volunteering across AtlantiCare has been closed since March of last year. When do we plan to resume volunteers in the hospital?
I think as you slowly see us opening up for visitations and such, I think you'll be able to start seeing volunteers come in. We use, again, those different matrices in the county as well as in the hospital, as well as the case growth, making sure that we're not having more and more cases of new COVID in our area. That would allow us to open the doors even further for volunteers. I don't think we're there yet. As you're noticing, we're still having some spikes in cases, but I think and I anticipate shortly, hopefully by the summertime, we should have a better grip on it.
And there is a team that gets together on a regular basis and talks through, like there's no one person sitting in an office making all these decisions. It's really a collaborative effort, and you're there. Members of the other parts of the organization are participating. Is there any information about whether the state of New Jersey will require students, staff, and faculty have received the vaccine in order to resume normal campus operations?
No, there's really no recommendation as far as kind of making it mandatory for students or teachers or anybody really in hospital settings, school settings to do so. Certainly there's an encouragement. You want to try to get as many people who are eligible to get vaccinated because that would reduce the risk of spreading it in your system. And while doing that, maintaining what you've all been doing as far as 6 feet separations and wearing the mask, I anticipate to have a decrease in numbers very soon. So.
And just, we haven't seen much routine normal flu, right?
Which has been phenomenal. And that's kind of a testament. We had this conversation today about the masks and how good and effective they've really been. Usually at this time in the season, flu is
we're overrun with flu.
Exactly. and there's a lot of death with flu still. There's a lot of illnesses with flu. We haven't seen really 1 or 2 cases max in the hospital, which is surprising and excellent in some terms because we've been able to wear the masks and prevent that.
Yeah. So we've finished with the questions that we received. So I'll turn it back to those in charge of our time together. And just, I guess, I'm not sure who's going to be asking, but go ahead.
Thank you so much, Ms. Herndon, Dr. Trivedi, for taking time to answer these questions from our community. We value your expertise so much. I'm Emery DiGiorgio, and I, along with my colleague, Peter Barata, have co-chaired Stockton's University Resilience Operations Committee, also known as UROC. This is an institution-level team of students, faculty, and staff helping to analyze our local issues and recommend operating principles for Stockton during the COVID-19 pandemic. So Peter and I have been keeping an eye on the questions coming in. And if you're ready, we have some live follow-up questions.
Sure.
So the first, you've partially answered, but specifically, how might college students get the vaccine?
Well, part of what we're following is the state, requirements, and they've been very specific about, who would be going next. So I would imagine we'll have that direction. I don't know if you know anything.
No, exactly that.
that.
The eligibility has been, I guess the ring is what we would call it, the ripples in the pond, so to speak. They've been slowly expanding, and we're seeing that the eligibility is starting to open up more and more. I think there's a lot of frustration in the community right now because, as you've heard through some of the questions early on, that it's getting difficult for some people to get the vaccine, yet they're expanding the eligibility. That being said, we anticipate that to be sooner and sooner. They just said that asthma, for instance, is a comorbidity that makes you eligible for the vaccine. So there's different conditions that would allow it, but not specifically by an age. So unfortunately, that's not there yet. But these comorbidities are starting to increase to allow more people to get vaccinated.
Yeah.
Thank you. We have some questions are going to be somewhat repeated, maybe
Sure.
because some individuals came in a little bit later. We also have some very unique and discrete questions, and this one is somewhat unique. Is it possible for the Johnson & Johnson vaccine to cause someone to test positive for COVID?
No. So, it's not a live virus. Meaning it doesn't use a live COVID virus or attenuated COVID virus. So it's very similar to the Pfizer and Moderna. What they do for the Johnson & Johnson is they use what's called an adenovirus. Adenoviruses are relatively stable and they're easy to manipulate. And so what they do is they hollow out the capsid, meaning the part that transfers all of the genetic material. They take that out and they place in the material that creates spike proteins. And that kind of goes in and injects it into cells, and your cells start to develop these spike proteins. But it's not a live virus, so you wouldn't test positive in that circumstance.
Thank you. Another question connected to questions about severe allergies. The individual asks that they've heard individuals' severe allergies, anaphylactic reactions with certain foods are being advised against getting vaccinated. Is this true? And if so, would you recommend getting the J&J shot since it's a one-time risk of reaction?
No, so that actually is not true. We don't recommend that even if you have severe allergies to food, for instance, you're still eligible to get the vaccine. We just want you to notify your vaccinator that you have severe allergies, that you carry an EpiPen, so that we can monitor that. Really, there's just a few components of that vaccine that we're cautious of. Some of the components include a polysorbitol, which is like a type of like lipid that people end up having reactions to, and that's the one that's really concerning. But as far as foods, other drugs, for instance, not an issue. You should be fine.
Can the Pfizer vaccine affect our DNA?
Yeah, so that's a big misconception. That's a great question. So messenger RNA does not affect DNA. Messenger RNA doesn't go in and alter DNA at all. All messenger RNA really is a blueprint. And so these Pfizer vaccines, Moderna's vaccine, and J&J use messenger RNA technology in different ways to tell your cells to develop a certain kind of thing. And that thing in this circumstance is a spike protein. Those spike proteins in your cells last for however long the half-life of your cells are. So for instance, circulating cells at most last 180 days. After that, those spike proteins die off with the cell. It doesn't change or alter DNA. What it does is create antibodies that will circulate hopefully much longer to recognize these spike proteins in the future to prevent that from coming into the cell.
What do we know about the vaccine's abilities to prevent transmission in addition to preventing bad infections?
That's a great question too, and that's what ongoing research is going right now. What we know is that in the early onset of these trials, Moderna conducted a very small trial using roughly around 56 people or so, and found that around 38 people were unable to transmit the virus after getting vaccinated. What you're seeing now is we're doing secondary trials as more and more people get vaccinated, and as you see the CDC becoming more and more lax about vaccinated individuals, I think the ongoing consensus is that you have very minimal amounts of transmission, if any, once you're vaccinated. We know that the virus lives in your nose, lives in the nasopharyngeal passageway, so you'd be able to theoretically breathe that out, cough that out, scream that out, and someone else could breathe that in. But the replication, meaning the amount of virus that would be shedding, would be far less because the vaccine should prevent that.
After a person has scheduled their first vaccine appointment, maybe even either at the convention center or at one of the local sites, how is the second one scheduled?
So that's actually usually for instance, at the mega site. Before you leave, you have an opportunity to schedule your second shot. That's typically 21 days or so after your first shot. When you get home, let's say you forgot you had an engagement on that time, you can modify your appointment online, and that's a very quick process. Other vaccination sites, for instance, CVS and such, ask you to call back roughly around the time frame, and then they'll schedule you right away during that time. But at the mega site, we know for sure that you already have a guaranteed appointment once you get your first injection.
Yeah, we have staff that are part of the observation process, and they're carrying around iPads. And so they'll come up to you and like, here's the schedule, what day works, and you'll have your appointment before you leave.
Mm-hmm.
Thank you. Are there any known side effects of the vaccines? And is it true that we don't quite know what the vaccine will do to individuals over time?
So, the side effects, the initial side effects, we know just through data and just accumulating that information. We know that some people develop malaise, fatigue, low-grade fevers. Sometimes you get what's called lymphadenopathy, meaning your lymph nodes may swell on the site of the injection. Some people get low-grade fevers. Some people get even higher fevers. But typically, they last roughly around 48 hours. They say up to 72 hours can be these side effects, and then you should feel back to normal. As far as long-term side effects, as I mentioned earlier in this, that these spike proteins don't last in your system very long. It's more so the antibodies circulating that you have, like any other vaccine. So as of right now, and again, this is still in its infancy, but as of 8 to 9 months of the development of these vaccines, we know that there aren't really any kind of long-term lingering effects after the vaccine.
Do any of the vaccines have polysorbitol? And if so, what concerns might that cause?
Yeah, so they do, and so for instance, the Moderna or the Pfizer both use that as a component of the lipid that they use to transmit the messenger RNA. The only concern is if you have allergic reaction to that in the past for other reasons, that's when you would want to look into that and just make sure that that's not an issue for you.
And telling, but you could still have the vaccine.
Correct.
Right?
That's right.
We just need, I work as a vaccinator, so
Yep.
we ask those questions, to our patients before we inject the vaccine. So
I may not pronounce this next question quite properly, but does the vaccine affect a person that has Guillain-Barre syndrome? And would you recommend that this individual receive the vaccine?
So Guillain-Barre is a type of syndrome that occurs. Typically, can be infectious causes or non-infectious causes as well. For an individual who's had Guillain-Barre in the past, this vaccine hasn't shown to cause Guillain-Barre as well. Again, this is one of those kind of facts that you want to tell the vaccinator so that we observe you longer. Typically, Guillain-Barre happens within the first 15 minutes of a vaccine, if that were to happen. It hasn't happened with any of the COVID vaccines, but it's still information that we would want to use.
If you are a breast cancer survivor, should you get the shot in the opposite arm of the side you had the lumpectomy?
So it's a good question as well. You're seeing a lot of information right now in the news and in the media regarding mammograms and getting the shot and when to get a mammogram appropriately. We know that, as I mentioned earlier, some of the side effects can be lymphadenopathy at the site or at the area of the vaccine shot. And it can sometimes be confused if you don't give the information to a radiologist that, hey, I got a vaccine. Could this be just lymphadenopathy rather than an actual mass or cancer developing? Recommending it in the opposite side is certainly useful, but again, telling your radiologist before a mammogram is probably more important, so that way they can keep an eye on that.
I guess the question is, if I had a mastectomy on the right side, which arm would I get the vaccine? Would it matter?
It wouldn't matter in that regard. Yep.
Can you speak on the Bell's palsy side effect, and how common is this, and are patients recovering from this?
Yeah, so Bell's palsy is another kind of infectious and non-infectious syndrome that can occur. Typically, it occurs in the first 15 minutes, again, of vaccination. It's exceedingly uncommon. It's not to say that it hasn't been reported throughout the phase 3 trials. What they found in all of these trials and all of these patients that have been vaccinated thus far is that there sometimes is an underlying condition that because your immune system revs up, flares up, and that's why you develop that Bell's palsy. Every single one of those Bell's palsy patients in the vaccine trial went on to have full recovery. Unfortunately, the recovery takes some time with Bell's palsy. Oftentimes it takes several weeks to months to return to baseline. But again, it's exceedingly low. I believe there was like 8 in so far out of the hundreds of thousands of people that got vaccinated.
This question, I think, was originally geared for Stockton, but maybe we can expand it to throughout the state. Do students living on college campuses get the vaccine quicker?
So no, not necessarily. I think the way to get the vaccine is just to meet eligibility criteria. People who live in congregate livings and situations and such are not at a higher eligibility than others. And so, unfortunately, no, it doesn't allow you to get the vaccine sooner. It's more so the other comorbidities. I think as the state expands that even further, you may start to see that happen.
The next few questions are all connected similarly to that, so I think that they fall under the same umbrella. There is a question about Stockton specifically, but I don't know if that's appropriate to both of you, but perhaps you could offer the university some advice in this way here. So the question is around, what can Stockton do to ensure that those who don't get the vaccine, so that they don't feel outcasted as someone with medical issues who are unable to be vaccinated? How can the university create a supportive environment so that medical ailments are not, problematic for their participation in the university community?
And I think what you're seeing, and I think Stockton's done an excellent job of this thus far, is really maintaining the rules that we've kind of done in the community, wearing a mask, maintaining that physical distance. As you start to get vaccinated, those people who aren't able to get vaccinated for those circumstances, I think to continue that supportive measures of everybody kind of maintaining that. The idea is to get vaccinated so that you can protect the person next to you. Not only does it protect you, but it protects the person next to you as well. And that's important as far as encouraging other people to get vaccinated so that really no person's left behind.
I just want to add, you might all be interested at AtlantiCare. This is all of AtlantiCare. We're at 64%. So I would love to see that number continue to rise, but we're not at 100%, we're not at 90%. I would say our numbers are probably higher than a lot of other health systems. So we're really a reflection of the community where people have conditions that can't, that they really can't. People choose not to for different reasons, and we're not making it mandatory at AtlantiCare, but we're encouraging people. And we went a few weeks without any available vaccine for our staff, and when we got some more, we saw many more people come forward. So some people have, they needed more time to see what's happening. They had more questions. So I believe that number will just keep going up as we continue to see how safe and effective it is. And but I do recognize that it's going to be a challenge for, as we start to open things up, when somebody chooses not to get the vaccine, kind of how we're going to work with them to protect them, but they're going to have to continue to wear masks. Similar at AtlantiCare, it's a big requirement to get, I shouldn't say requirement, it's a big push to get the flu vaccine.
That's right.
But if our employees choose not to get the flu vaccine before COVID, they needed to wear masks. So that was our process. And I don't know if you can see this really well, but we have they're like little beach tags. So I have a beach tag that says I had the flu vaccine, and I have a beach tag that says I had the COVID vaccine. And that's, a nice way, at least the way we've been doing it, so that people know that I've had it. Just a thought as you guys roll out your policies and procedures.
We have a question that's taking a step back about COVID testing itself. Stockton has had a very effective and efficient testing process on our campus. The question is, does it matter, or should students go through Stockton for testing or go through the NJ portal? Again, they can very easily schedule testing through Stockton. Could you give us just your experiences overall with how testing is running from your experience beyond the campus of Stockton?
I guess, do you know if you're doing PCR or antigen testing?
Yes.
Which one?
We're doing PCR.
Okay. So
outside of the campus, and that sounds excellent, but outside there's availabilities to get testing through all of our urgent cares, as well as there's commercial pharmacies that do so as well. PCR, of course, has its drawbacks, but it's an excellent test. Antigen testing has its drawbacks as well, and it's a very good test. But nonetheless, we do offer that. And the availability of testing, initially, if you notice in our graphs, there's these blue bars that you may have kind of seen. That was what we would call people under investigation, because testing was so scarce, and we had people that clinically looked like they had the illness, but we weren't able to confirm that. As you've noticed in the graphs moving forward, we don't have that issue anymore because testing is readily available. I don't think that's become an issue in the community at all anymore.
And I think maybe you can explain the difference between there's not one that's better than the other. Right. I just want to be really clear, but there is this interest, especially for your healthcare provider, that should be involved. I think what's playing out is people can just go get tested on demand, but it would be great for them to be a part of a discussion with the healthcare provider, because there's some nuances between the different types of testing.
Exactly. And I think that's the interpretation of the information is really important. So PCR testing really is like a spotlight on the disease process. So whether you had old virus just kind of denatured and shedding broken down virus versus an acute illness, it won't be able to tell you the difference between the two. So how long can you shed old virus or broken down virus? Some people shed for months, 3 months, 4 months, 5 months. And so you could test positive for several months despite not having any symptoms or illness. And that gets very tricky with these patients who are asymptomatic, for instance, carriers. And you're wondering, is this real active disease, or is this old disease from when you previously had COVID? Antigen testing is more of the acute illness. So if you have symptoms, it's an excellent test to test for true positive infection. But if you're asymptomatic, the sensitivity of that test is not as strong as a PCR. And so you have to be very careful with that.
So just you can understand the nuances. And I guess I, still get into discussions with people who think they're exposed and they're running out right away to get the test, which is a complete waste of time and money. Can you just talk about
that? Was our biggest kind of issue in the beginning about when testing was more available. People wanted to get tested right away. Hey, I was out with somebody. We know that the incubation period of the virus is 2 to 14 days. So just because you tested negative on day 2 after a high risk exposure, or day 5 or day 7 or 10, you could still test positive at day 14. And that became the frustrating part. People didn't want to hear, hey, you have to quarantine for 2 weeks. They thought the negative test would be a blanket kind of check, a blank check, for instance, to go back out and work and be in the community. But the truth is, if you had a high risk exposure without a vaccine, you have to quarantine during that time frame. The CDC is starting to change those recommendations, knowing that the peak onset of these illnesses is around day 7. So if you test negative at day 7, you're still going to be very cautious on return, but you'll be able to return safely.
Thank you. A question came up. Can you talk about carrying the virus if you're fully vaccinated and the chance of passing it to someone else who isn't vaccinated, such as a child or anyone else?
Of course. So if you're fully vaccinated, what it does is it's supposed to prevent the virus from entering the body and replicating in your cells. The idea is that the virus enters, and the virus has what's called spike proteins. And those spike proteins are recognized by your antibodies, and they deactivate the virus. They attack it right away. And so it doesn't have a chance to replicate, but it can still kind of live in your nares and because you breathed it in. And because of that, we don't know these surface antibodies, how well they can attack this virus at first. And so it may not be able to replicate over and over, but you still have a chance, although very slim is what data is showing, of spreading that to other people. And so you have to be cautious during that time. If you had a high risk exposure, if you're not wearing a mask in circumstances and you may have been exposed, you have the potential to shed that to somebody, although less and less information, or less and less likely because the information is coming out now.
And we're seeing more research in that.
That's
so
right.
That'll either be proven to be somewhat vague
That's
and
right.
never get really clear, or it'll eventually get clearer.
That's,
right?
and the idea is that as more and more people get vaccinated, the likelihood of being able to spread it to somebody is far and far less, because they wouldn't be able to have...
I can't catch it.
Exactly.
Well, that was the final question we received from the live session. So thank you very much for your clear and comprehensive responses. And we will turn things back to President Kesselman.
Well, first, Laurie and Dr. Trivedi, I want to thank you on behalf of everyone at Stockton, not only for today's session, but all of the sessions throughout the pandemic. You've provided a sense of comfort to all of us, and your approach has been extremely scientifically based, as current as the information is, and you are great role models for all of us. And I appreciate you taking the time to do this. I want to thank Peter and Emery for the incredible work they've done throughout the year also, in ensuring that the Stockton community remains current with this issue. As information comes out from the state and from CDC and the like, we will obviously get it to the campus community, and let's hope everybody, continues to wash up, back up, mask up, and now vax up. So with no further ado, we'll see you all. Thank you very, very much. Laurie, Manish, see you very soon.
Thank you.
Bye.